Have you ever felt bloated or uncomfortable after eating certain foods? This discomfort might be due to gluten intolerance, a condition where your body reacts negatively to gluten. Gluten is a protein found in wheat, barley, and rye. This condition is also known as non-celiac gluten sensitivity. So how does it work? When you consume foods containing gluten, your immune system responds in quite a unique way. It starts attacking the gluten proteins. This reaction leads to a variety of symptoms, which we'll delve into in a later scene. It's crucial to note that while this condition may not be as severe as celiac disease, gluten intolerance can still significantly impact your quality of life. Wondering what causes this uncomfortable condition? It's a question that's puzzled many, and the answer isn't one size fits all. Gluten intolerance can be triggered by a variety of factors, both genetic and environmental. This means that the root cause can be anything from hereditary predisposition to certain lifestyle elements. Let's delve a bit deeper. Some people are genetically predisposed to gluten intolerance. This means that they have genes that make them more susceptible to developing the condition. However, just because you have these genes doesn't mean you'll definitely get gluten intolerance. It's a bit like having a jigsaw puzzle piece. It might fit into the overall picture, or it might not. On the other hand, environmental factors can also play a significant role. Changes in diet, stress levels, and overall health can potentially trigger gluten intolerance. It's important to note that not everyone will experience this condition, and it can develop at any age. The cause can differ from person to person, making it even more crucial to understand the condition. So, how do you know if you have gluten intolerance? It's not always easy to pinpoint, as symptoms can vary greatly from person to person. However, there are some common indicators that might suggest your body is reacting negatively to gluten. Digestive issues are often the first sign of gluten intolerance. This can include bloating, diarrhea, and constipation. You might also experience a general sense of discomfort in your stomach after consuming food containing gluten. Energy levels can also be affected. If you're feeling unusually fatigued or lethargic, and it's not due to lack of sleep or physical exertion, gluten could be the culprit. It's not uncommon for individuals with gluten intolerance to feel drained of energy, despite getting a good night's sleep. Joint pain is another possible symptom. This discomfort can manifest in any joint, but is especially common in the knees and fingers. Your skin might also react to gluten. Rashes, dry skin, and other abnormalities can all be signs of an intolerance. Lastly, gluten intolerance can impact your mood. Many people report feeling irritable or depressed when they've consumed gluten. Recognizing these symptoms can aid in early diagnosis and management of gluten intolerance. Now you may be wondering, how is gluten intolerance diagnosed? The process of diagnosing gluten intolerance involves ruling out other conditions that could be causing your symptoms. This is important because symptoms of gluten intolerance can mimic those of other dietary disorders, such as lactose intolerance or irritable bowel syndrome. In some cases, healthcare professionals may suggest an elimination diet. This involves removing all foods containing gluten from your diet and then gradually reintroducing them to observe any changes in your symptoms. If your symptoms improve when gluten is eliminated and worsen when it's reintroduced, it's a strong indicator that you may be dealing with gluten intolerance. However, self-diagnosing and self-treating can lead to missing a more serious condition or not getting the necessary nutrients. That's why it's essential to seek professional help for a proper diagnosis and guidance on how to manage your diet effectively. Remember, knowledge is power. Understanding your body and how it reacts to certain foods is crucial to managing your health. Diagnosis is a crucial step in managing gluten intolerance and improving your overall well-being. We've covered quite a bit about gluten intolerance today. To recap, gluten intolerance, also known as non-celiac gluten sensitivity, is a condition where your body reacts negatively to gluten, a protein found in wheat, barley, and rye. The causes of this condition can include genetic and environmental factors, and the symptoms can range from digestive issues to changes in energy levels, joint pain, skin conditions, and mood swings. Diagnosing gluten intolerance involves ruling out other conditions and may require elimination diets. Remember, it's not as severe as celiac disease, but it still significantly impacts your quality of life. However, managing gluten intolerance is achievable. It involves a strict gluten-free diet, careful label reading, and exploring gluten-free alternatives. Understanding these aspects of gluten intolerance can help you make informed dietary choices and enhance your quality of life. Remember, professional help is essential for effective management.